Over the last few years, what I've found is there are three areas of research for motor neuron disease. You've heard from a couple today. The first is environmental and social, i.e. what can cause motor neuron to start in a patient. And so Massey University is undertaking some of that research at the moment, and I've been a participant in that. You will know a lot about that now. The second is how can you slow, halt, or completely recover from motor neuron disease, and the research into that. Recently, I attended a clinical trial of a drug called MP001. That drug has come into test phase. It's done phase 1. I participated in phase 2, which was 103 patients, mostly from the US, but some from overseas like myself. I attended it for 9 months in San Francisco. The impact on me over the 9 months is I did meet a number of people. It was a very positive experience. It gave me hope, but it would seem that in that 9 months I have progressed a lot faster than previously. I believe that's just due to timing and bioprogression, but I did not see any halt process. As 30% had placebo, probably I was one of the placebo people. Now that has its own impact on patients, and many patients are refusing to go on trials in the US where there are placebos given, because they say with a motor neuron patient they should not give placebo, they should give all patients a chance of getting the drug. That's a different topic, but you will see some of that on patients like that. Another group that's doing a lot of research in this area that you could look up, it's called ALS-TDI. This group is a not-for-profit group. It gets millions of dollars of funding, and it researches different drugs that might help the motor neuron patient. What I found as a patient is the third area of research, and that is living with motor neuron disease and how to treat the symptoms and to bring as much normality back into your life as you can. So, this is a dicta splint or something similar to this. This is applied to the leg, and is hooked onto hooks on the foot. I don't have any hooks on my foot at the moment. This device is used instead of an APO brace. This foot in the office or indoors, very comfortable, wear it all day. The APO brace is for those short times that you're on a bike or in the garden. Travel and be in a social level. A wheelchair is not a social level unless everyone else is sitting down. So when I travelled to Italy and Europe and other places, I found a small folding bicycle was the way to move, because my head was at the same height as the people around me, so I could talk with them, I could socialise and move at the same speed as them. So it's all about how do I stay similar to the people around me in all contexts, socially, health-wise, etc. Another one was breathing. What I've identified is most breathing machines are designed for overnight sleep. As a motor neuron patient, I have found it very good using it during the day as well, for giving me good energy and being able to talk almost non-stop, as you can see on this video. Now, what I found was, this was the mask that was given to me to start with, and possibly given to you.
As you can see, it's almost impossible to talk.
And he looks somewhat like an outer space man,
Yes.
doesn't he? Not exactly conducive to feeling an equal with the people that you're interacting with.
That's right. When the breathing's going, you can't even talk to your wife to ask her, could you help pull me over or turn me over?
Mind you, if you're the wife, that could be an advantage.
Yes.
So I got rid of this very fast. And then moved on to this mask. This mask enables you to talk, eat, drink, but what I use this for is sleeping. My wife asked, can't you have one which is just up the nose so that it's not bulkily covering? And this one was what was provided.
This is the Polaro, which is a very comfortable mask, but slips and slides around, and you really can't drink or eat unless you want to get this covered with cream and everything you're eating. But it's a very good one for comfort. This one is very soft. Best for eating, drinking and talking. If you have a cold, your lungs fill up with phlegm. And my lungs were used to be 6 litres. I could only breathe about 2 litres sitting up or 1 litre lying down. But the breathing machine really helps me. Now why does it help me? For 6 months I had poor toileting. I had going to toilet 3 times a night, falling over. And I never looked back. That morning after, when I woke up, it was like blue skies. The sun was up, my energy was back. And I said to my wife, I want to apply to NASA to be an astronaut. I was so energetic. And now I have the energy of before I had motor neuron disease, because this breathing machine has revolutionised my energy. And I wear it on my wheelchair. I have a battery pack on my wheelchair. I wear it downtown Lambda Key. I wear it in restaurants. What else could I do? What they said was, the physio at the hospital said, get access to a cough assist machine. And this will really clean out your lungs. And it's a good preventative if you are like myself with poor lungs. And if you've got a cold or something else, then this saves your life. The machine has a bacteria filter, a tube and a mask. This is a battery powered machine that you can travel with, and it's very easy. It costs around $12,000. I'm trialling it at the moment and testing it. Whoa, it's sometimes hard to see. Okay, that's about 5. So, no damage to me, but then you do a huff cough. And I'm not very good, you're probably better than me, but you get it and you go. Doing that means that my lungs have had a good refresh, and then when I'm back on the breather, well, as you can see now, my breathing's a bit easier. And so it's preventative as well as life-saving.
And Neil, I realised instead of that being the last one, you also talked to me about you've recently discovered the joy of swimming in hot pools.
Yes, many patients will realise that our limbs get very cold and they get very uncomfortable, and maybe even our toileting and that isn't very regular. So what I found was in Wellington they have a hydrotherapy pool actually at the swimming pool, and we can go and I float. My lungs don't work very well, so I float on my back so I can breathe. And I have flotation aids and noodles around me, and it's very social as well. I've got an iPad already with the software on, ready to go for speech. I got the breathing machine early, I got the wheelchair early. I get anything I can early, like the cough assist. Not when I've got a cold, get used to it beforehand. Why? Because I want to stay alive and enjoy my life. And if I got my breathing machine when I really, later on, it would have been hard, because it actually cut my nose to start off with, and I was bleeding in the first week or 2. So you've got to wear them in like a new pair of shoes, and you better do that before you're really sick, because you won't do it, you'll reject it. So think of getting these things early, think of getting used to them. It gets your carer, your wife or your husband used to them operating, and it means that you operate before it's life-threatening, because maybe this machine could actually hurt someone if you were too sick and using it for the first time. Same as wheelchairs. You get used to driving it when you've got good hand movement, then when you've got poor hand movement, the wheelchair will drive itself.
And that's a fantastic message, Neil, because it's so hard sometimes for any of us to accept that things are going to get worse, and unfortunately that's a reality with motor neurone disease.
That's right. For example, on Monday I'm going to get a peg on my stomach for feeding, and that will mean I can't swim for 6 weeks. So I had to do a trade-off. Do I get the peg and stop swimming for 6 weeks, or do I not? Well, I want the peg there if I need to use it. I may never need to use it, but I want it there ready to go, because I've seen so much benefit through my mum of having a feeding option other than through the mouth. So I'm into whatever can be done, get it early, get it working and get used to it, because life requires you to wear a new pair of shoes in before you can go dancing. And I want to dance.